Hi, I'm Larry Nespoli with the New Jersey Council of County Colleges. At New Jersey's community colleges, we believe that our students, as well as all citizens, need to be informed about the important issues facing higher education. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child. Wells Fargo, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons PC, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. And by New Jersey Natural Gas, proud to support education in our communities. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey. And by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hi, I'm Steve Adubato. We're coming to you from the Hyatt in New Brunswick, New Jersey. This is an event, a very important event, a historic event, celebrating the 50th anniversary of the signing of the Community Mental Health Act of 1963, signed by President John F. Kennedy. Today, here in New Brunswick, experts from across the East Coast have come together, primarily those in New Jersey, talking about what we've accomplished, how far we've come, but also looking to the future. That's why Perform Care, the main sponsors today, they have the brochure that says, Celebrating the Past, Creating Our Future. One of the people recognizing, celebrating the Community Mental Health Act of 1963, one of the leaders in this community is Tom Bufuto, who is in fact the Executive Director of the ARC of New Jersey. Good to see you, Tom.
Good to see you, Steve. Thanks for having us.
By the way, Tom, why is it so important to recognize and celebrate this 1963 historic act?
Well, I think that was the start of removing the stigma that existed for folks with intellectual and other developmental disabilities. It really laid the groundwork for the future, having people live in the community, being part of the fabric of their community, and actually was the precursor to the ADA, which really addressed
the Americans with Disabilities Act.
Americans with Disabilities Act, which really eliminated many of the discriminatory practices for folks with intellectual and other developmental disabilities.
For those who do not know what the ARC is, it is?
We are an advocacy organization for people with intellectual and developmental disabilities. We have chapters in every county of the state providing supports and services to children and adults with intellectual disabilities.
One of the most interesting projects that the ARC is involved in is something called Project Hire. Because when you talk about people dealing with mental illness issues, those with developmental disabilities, employment issues are used. Project Hire is?
It's a statewide supported employment program for folks with intellectual disabilities where we carefully match people to jobs, regular jobs in the community, and then provide them supports on the job so they can learn the job and be successful there. You know,
give us an example of that.
Well, certainly it could be the Hyatt here, which hires many people to do clean rooms, keep up the maintenance. We would find somebody with an intellectual disability who wants to do that work. Then we'd send one of our staff down here to actually take the time, teach them how to do the job, stay as long as necessary, then slowly fade off that job and provide long-term supports. So whatever the job may be, we're here to support that person on the job. And you know, see, employment is so important to people. It helps with self-esteem. It gives them money to make choices. We want people with intellectual disabilities to be part of the workforce, and quite frankly, they want to be part of the workforce. They just need the opportunities out there.
And finally, for those who say, well, you know, as long as they're taken care of and they have a place to live and something to eat, that's good enough. You say no.
No, people with intellectual disabilities are just like you and I. They want to be part of their community. They want to participate in the community. They want to have jobs and career dreams, and they need the supports and services to be able to do that, to live independently in the community.
We're here with Hal Garwin, who is President and Executive Director of the Community Health Law Project. Hal, why was that act so important in this country in terms of how we treat those who are dealing with mental illness?
Well, I think the main thing is for the first time there was a public activity which was going to try to keep people in the community, provide them with the needed services, and do it regardless of income. It was either subsidized by public dollars or on a sliding fee scale. So for the first time, rather than institutionalization as being the main focus of where people were placed if they had mental health problems, it was the attempt to keep them in the community and prevent institutionalization. That's extremely important because what it also engendered was the beginning of the civil rights effort for people with mental health problems.
Talk to us about the work of your organization and why it's so significant.
Well, the Community Health Law Project was created to provide assistance, legal and advocacy services to people with disabilities, particularly in the early days with mental health problems, to try to enable them to stay as contributing citizens in the community. So our main...
Give us an example, like what would, give us a legal or civil rights issue or problem or challenge that someone with mental health problems would face that someone else might not face.
Well, let me tell you the basic issues. If you're going to remain in a community, you need to have housing, you need to have income, and you need to have access to health and social services. So one of the main issues that our organization focused on was how do you help people who have little income and no health insurance do that? Well, you try to get them income. So if they're eligible for public entitlements, either welfare or Social Security, you try to get them onto one of the programs. If you get them onto a Social Security program, SSI for example, right, Supplemental Security Income, then Medicaid comes with them. They have health insurance. You get health insurance, then you can pay for care. So that your treatment then becomes an issue of being able to stay in the community. You don't have to be institutionalized to get treatment. So that's one thing. If you have housing, you're not homeless and wandering the streets. If you have supportive social services, then not only will you have housing and treatment, but people can help you with a myriad of your civil issues. Our attorneys and advocates represent people in consumer problems, landlord-tenant issues, and a variety of other civil problems. We don't do criminal work, but we do everything that a normal, small, private firm would do for you if you came to us.
Important work. And finally, for the folks who sponsored today and recognize the 50th anniversary of the signing of this very important law in this country, what would you say to those folks?
Well, I would say that we have to continue working hard to make sure that people who have mental health problems can remain in the community as contributing citizens so that their efforts to increase quality and quantity of services in the community is the most important thing.
This is the 50th anniversary of the Community Mental Health Act of 1963, signed by then President John F. Kennedy. That is a very important act that changed the way those who are dealing with mental illness are treated dramatically. And we're here to talk to those who really understand it, who have been in the trenches, who have been struggling with, dealing with, trying to advocate for those who are dealing with mental health issues. And I want to introduce Dr. Debbie Wentz, who is Chief Executive Officer, New Jersey Association of Mental Health and Addiction Agencies. Debbie, we've talked to you before about these issues, but this event, this forum put together by Perform Care is so important. Why?
It's conversation changing, and it really was life-saving. When President Kennedy signed the Community Mental Health Services Act in 1963, it meant that people who had been warehoused in institutions for all of their lives had the hope and promise of living in the community and recovering and living with family and friends, working, being part of the communities that they lived in. And so it changed the illness from being perceived as locking people away as though they were social outcasts.
Institutionalizing them.
Yes, and it brought them into the mainstream of life. And the symbolism of the signing was the beginning of that. So it really portended great promise, great hope, and a bright future where people would no longer be stigmatized and discriminated and locked away.
Let me ask you this. While this is the 50th anniversary and we recognize and celebrate the Community Mental Health Act of 1963, there's a lot of work that still needs to be done. And in New Jersey, we particularly appreciated post-Hurricane Sandy. We're doing this event. We're here taping about a year in after Hurricane Sandy. You and your agency, many who are here today, deal with work with, try to help those who are still struggling from Hurricane Sandy. A lot of emotional and mental health-related issues there, right?
Yes, trauma sometimes becomes more evident months and even years after event. What happens is that people deal with their loss in the immediate, but as time goes on and they see that life is no longer going to return to normal, their home is lost, their businesses may be lost, their whole life has changed, a depression sets in, and that depression can be paralyzing. People begin to lose hope.
What do they need?
They need help through treatment and services and support, both of professionals, their community, and families, so that they can understand that life might not be the same, but that there's hope for the future, and they need to get back on their feet, both in terms of their physical surroundings, but emotionally, so they can go forward despite the fact that they've been traumatized and they had severe loss.
We're here with one of the leaders in the mental health advocacy movement. He is Phil Lubitz. He is the Associate Director and Director of Advocacy for an organization called NAMI, New Jersey. NAMI stands for?
That's the National Alliance on Mental Illness, Steve.
What do you do?
Well, NAMI was an organization that was started by family members back in 1979 to advocate for better treatment care for persons with a serious mental illness.
Explain to folks, Phil, so many of the people we're talking to here at this conference, put together by our colleagues at Perform Care, are saying that you can't treat mental illness just by treating the patient. You have to treat the family. But what does that really mean from a practical point of view?
Well, I think we've learned that we're dealing with more than just symptomology. There's a whole person we're talking about. So his environment, his living situation, his social environment, the supports they have. Those are all elements that are important in an individual's recovery.
Give us an example from a practical, less from a clinical point of view, but more from a practical point of view, so people who are trying to educate on public television better understand exactly what you mean.
Well, I think of your own life. And, we really don't act as isolated individuals. We count on friends and families for support. When we have a problem, we go to them. We need a sense of place. We live in a community, and people with mental illness are really no different. They need a sense of community. They need a sense of purpose in their life. They need a sense of belonging in their life, and I think that's what we talk about when we say we have to treat the person, the family, and really create a whole community around people.
And finally, Phil, the expression being used today is celebrating the past, right? The last 50 years since 1963, when this Community Mental Health Act was signed, but creating our future. What is the future we're looking to create for those who are struggling with mental health issues?
Well, I think it's just that. We really have to think of more than just symptomology. We have to think of the whole person living in a society. We have to really promote the idea that people are recovering and will continue to recover as we move forward into the future.
And that law was landmark legislation, critically important. It changed everything, didn't it?
For more than a century, people were locked away in isolation in institutions that had really grown to be enormous institutions, so that people are able right now, instead of being institutionalized, to take part in life, to really
be in the community.
In the community, that's right, and really to have all the rewards of living in the community again, to have a family, to have a job, to have a purpose for their being.
We're here with one of the many experts, advocates on behalf of those dealing with mental illness. He's Bob Parker, Chief Executive Officer, New Bridge Services. By the way, Bob, what is New Bridge Services?
New Bridge is a private nonprofit company that brings balance to people's lives. And we do that through mental health, addiction, children, youth, and housing services.
There's a New Bridge approach, and it's interesting because there is, in fact, a connection between addiction and mental illness. Help folks who do not have a clinical background understand what that is and why it's so important. The connection between addiction and mental illness.
It's very important. A lot of times people turn to substance abuse to relieve emotional pain. I drink, I take drugs to release the pain. And if we don't understand that substance abuse and mental health go together very well, we won't be able to treat the whole person. The objective at Newbridge is to look at all the dynamics of substance abuse, what kinds of medications are they on, what their emotional state is, how addicted, if they are addicted, or are they just using drugs because they want to feel better.
Finally, the significance of recognizing the 50th anniversary of the Community Mental Health Act 1963, signed by President Kennedy, and the Perform Care folks and everyone else who helped put together this very important forum.
I think the significance, Steve, is that we are out of the shadows 50 years later. Mental health, until Kennedy signed in '63, wasn't even talked about. We threw people in institutions. Now people are living well and recovering well in our communities. They have their own leases. And I think it's all because Kennedy gave that leadership in '63. It's amazing.
But we still have some things we need to do.
We have a lot of things to do. We need to coordinate our treatment between addictions and mental health. We need to get involved with people with developmentally disabled that have mental health issues. That's a huge emerging issue for the community. There's a lot of challenges. The good news is those challenges are out in the public domain. We're all talking about them. We're not in the closets. We're not hiding. We're talking about them in public. I've never heard the words mental health spoken more often since Sandy and our governor. It's an amazing transformation. It's not as scary as it used to be. Still scary, but not as it used to be.
And no one needs to be convinced of how significant that act was, the law was in 1963. What would you say the most significant development has been since 1963 that we can say, you know what, we're really proud of that, A and B, yeah, but we still have to do this?
I think one of the things that we have to remember is that it wasn't that long ago that things are really quite inhumane. I can remember when I first started working at the Mental Health Association, we began hearing from family members about the abuse of patients at our state hospital. We began to look into it and were granted access to the hospital at any time, day or night, and found that patients were dressing out of a common pile of clothing. If they didn't happen to have a pair of shoes that fit them, then they walked barefoot through the snow in order to get to the dining room. We've come so far from those days, and that was only 25 years ago.
So in many respects, I think most of us in this room understand that while there's a lot of opportunity for improvement, that New Jersey nonetheless is very progressive relative to most states in our country.
How so? One example.
Well, you know, I think the best example is to really look at the children's system of care that's evolved over the last 10 years.
The children's system of care? Describe it.
It takes the idea of a system of care to its, I think, really the truest and purest form of what we have nationally. It really is the embodiment of a safety net. It is acknowledging that we have a responsibility and necessity to be able to support our children and families, and that the best way to do that is to move away from an institutionalized mindset. And even, quite honestly, just some of the traditional elements that built after we moved to a community care model, you know, the outpatient, the intensive outpatient, the partial care, it took it to a different level. So in New Jersey, we developed care management organizations where we have a very robust case management, family support component, the family support organization, so the family voice is ever present within that process.
You think that's somewhat unique to New Jersey?
I know that that's something unique to New Jersey. I mean, it's actually shocking to say yes. You would think that that would be something that people would just accept as a given, that the family voice needs to be recognized, celebrated, and a part of the planning process and the support process for families, but unfortunately and tragically that's not the case. And then finally, the other piece that I would point out, I think, which is critical and a defining component of the New Jersey system of care is the mobile response and stabilization system, where we no longer have to have families call the police or send their child to the emergency room because they're feeling concerned about how things are going within their household and and their child's behaviors. And so now they're able to have mobile response that's able to come to their house, engage with them, de-escalate the situation, assess the situation in that natural setting, which makes all the world of difference in trying to truly understand what's going on, and then we can engage them in in-home services as well as the traditional continuum of services that are part of our system of care. So I think New Jersey is a wonderful example nationally.
Steve Adubato here in New Brunswick, talking to one of the leaders who recognizes the 50th anniversary of the, I'll call it the 1963 Community Mental Health Act, is Richard Lavastek, who is Executive Director, Families and Community Together, which is FACT. That is your acronym.
That's right. That's right. We're the care management organization in Union County.
Tell folks what you do.
We do case management for families that have kids with emotional and behavioral problems, which usually means kids that are caught up in the mental health system, child welfare system, juvenile justice system, families that have very complicated lives trying to sort out the best plan for their kids and how to guide them through these very complex systems. So we're their partner, and we provide some services to get them the services they need and to kind of resolve their family's problems.
It's interesting, Richard. I keep hearing people talk about the family, dealing with the family. Why would it be that you just simply would not deal with the young person, the patient, that is dealing with the clinical issue? Why is it the entire family?
Well, children's services are a little different from adults. You know, the issues around deinstitutionalization for adults was really about taking people out of the state hospitals. Kids never really had that kind of a problem in New Jersey. There was a state hospital, but it was relatively small, and it closed about 7 years ago. But there were lots of kids with emotional problems in different parts of the system. Sometimes they were in special ed. Sometimes they were involved with the child welfare system. Sometimes they were even in court because they got caught up in petty crimes or major crimes. But in every case, the parents were brought into these situations to try and sort out what the best next step was. Sometimes the parents needed some help in terms of parenting their kids, or they had their own mental health or substance abuse problems. So we recognized that in order to really move this project forward and to really make a difference, you had to bring the parents to the table, you had to engage them, you had to give them an opportunity to talk about their dreams and wishes and their needs for their kids. And I think once you do that, you create a kind of team that can really move the child forward in terms of the services they need.
Finally, much of the discussion at today's forum recognizing the 50th anniversary of the Community Mental Health Act of 1963, we'll talk about the stigma connected to mental health. How far have we come, Richard?
Well, I think stigma for kids takes very different turns. The recent incidence of bullying is a huge concern to people. Using some of the new technology to intimidate people, or to, the kind of name calling, or the kind of...
For people dealing with mental health issues?
Yeah, I think sometimes there are kids in school that are really struggling with how they fit in, and maybe they're dealing with their own personal problems, depression, sometimes autism, that kind of strange behavior that the other kids don't understand. And when you kind of tweet somebody's name and said something about this person, it could be very hurtful. So I think that's that kind of a new kind of stigma that we're dealing with. We're trying to get our arms around it to see what kind of education is needed to make a difference.
We are talking about the 1963 Community Mental Health Act, and it changed everything. And one of the people who really understands that from a ground level is Ginger Mulligan, a longtime mental health advocate. Ginger, talk to us about that act and why it was so significant.
It was so significant because the federal government didn't really want to play a part in funding mental health services, so it was left up to each state to determine what kind of services they had, what model they would use. And even 30 years later, things still weren't as President Kennedy had envisioned. We had been involved with exposing a lot of abuses in the state institutions, but at the same time advocating for community systems, everything that President Kennedy had said was important, having people close to their families, close to their community, shorter lengths of stay so that they would be able to maintain the independence and the support that they had from family and friends. So a lot has happened in the past 20 years, particularly in terms of children's mental health, where New Jersey has developed one of the best systems in the nation.
We have. How so?
Well, there was a lot of work that was done as a result of the children's right lawsuit against New Jersey because of failures in the child welfare system. But we have been instrumental in having the Children's Psychiatric Hospital included in that lawsuit. So as part of that, that was closed and community alternatives were developed, and a whole new system that was holistically oriented, that was oriented towards the strengths of the child and the family, not just the deficits, and to work holistically, looking at school, looking at their health, looking at their safety. And New Jersey's done an outstanding job in doing this.
John, I want to ask you, you've been advocating on behalf of those who are struggling with dealing with mental illness for how many years?
I've been working for about 35 years.
What motivated you in the first place to get so involved and be so committed?
When my children were little, I was looking for volunteer opportunities, and I had seen an ad in the newspaper for the Mental Health Association, and I went through some training, and I worked with the children who were in Marlborough Psychiatric Hospital. And from there, one thing led to the other. I had started my career in juvenile justice up in Massachusetts, but once I got involved in the mental health field, it was just a career that every day I got up enthusiastic about what I was doing.
The most rewarding part of it is?
The most rewarding part of it is seeing people whose lives are afflicted with something that was part of their nature, part of their genetic heritage, or part of stresses that created a biological change in their brains, but that they still had all of these other strengths in their lives, and to be able to see them be able to actualize the best that they could be.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by the New Jersey Education Association, Wells Fargo, New Jersey Manufacturers Insurance Group, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System. One-on-One with Steve Adubato has been made possible in part by New Jersey State Nurses Association.
Hi, I'm Daniel Misa, and I'm a staff nurse who works in a hospital. Nurses are educated and prepared to work in many places and areas, like hospitals, clinics, in research, and in the military. As members of the New Jersey State Nurses Association, we thank you for the trust you've given us. Since being included in the Gallup poll in 1999, nurses have been ranked as the most trusted profession every year, except in 2001, when firefighters received top honors. We are proud you have given us that honor.